Gentlemen, I want to ask you something honest and important. Have you experienced times when you wanted to perform, but your body didn't cooperate the way you hoped? Maybe your erection wasn't as strong as before, or perhaps it disappeared faster than you expected. I know this can feel deeply frustrating. Sometimes it even brings feelings of shame. Many men start thinking, is this just what happens when you get older? Do I have to accept this as my reality now? But I need you to hear this truth. You have more control than you realize. Yes, medications can provide temporary help. However, there are natural research backed techniques that can make your erection stronger, boost healthy blood circulation, and restore your bedroom confidence without relying completely on pills. Today, I'm sharing three proven approaches that can accomplish exactly this. The third one is rarely discussed, but it might become the game changer you've been searching for. Before we begin, I'd appreciate two small favors. Please click the like button if men's health matters to you and drop a comment letting me know your location today. I genuinely love seeing our global community expand. Also, subscribe so you receive my weekly guidance on boosting your energy, intimacy, and self assurance. Now, let's begin. First, we need to address a common misunderstanding. Many men believe erections depend entirely on testosterone levels or assume that difficulties must be psychological. That's incomplete. While hormones and mindset certainly play roles, the biological reality is that erections are primarily about blood vessel function. Let me explain what actually happens. Your arteries deliver oxygen filled blood into the penis. The specialized tissue inside captures that blood, and your veins maintain it there until climax. When those blood vessels aren't functioning properly, or when the supporting muscles lack strength, your erection suffers regardless of your level of desire. Therefore, instead of focusing only on hormone levels or prescription drugs, we must prioritize blood vessel health and pelvic muscle strength. That's exactly what these three techniques address. These aren't tricks or temporary solutions. These are scientifically validated approaches that target the underlying causes of weak erections, and they deliver results. For anyone joining me for the first time, I'm Dr. Ada James. I'm a urologist and specialist in men's health with 10 years of experience helping hundreds of men overcome exactly these challenges. What I've witnessed repeatedly is powerful. When men strengthen the fundamental systems that support intimate function instead of just masking problems with medication, their confidence transforms completely. They feel rejuvenated, empowered, and truly alive again. So let's explore the three techniques you can begin using immediately. Technique number one is pelvic floor strengthening, also known as Kegels for men. I understand some of you might be wondering, wait, aren't Kegels designed for women? Absolutely not. Strengthening your pelvic floor muscles ranks among the most powerful natural methods for increasing firmness and control. Here's the science behind it. These muscles surround the base of your penis and provide crucial support to the blood vessels that retain blood during erection. When these muscles are underdeveloped, blood escapes too easily. When they're properly conditioned, you maintain harder, longer lasting erections. On an emotional level, this creates genuine control. You stop worrying during intimate moments about losing your erection. From a practical standpoint, you can perform these exercises privately anywhere, whether you're driving, working at your desk, or lying in bed. Here's your step by step guide. First, identify the correct muscles. The next time you urinate, attempt stopping the stream halfway through. Those muscles you just activated are your pelvic floor. Second, begin practicing. Squeeze those muscles for 5 seconds, then release for 5 seconds. Complete 10 repetitions, doing 2 to 3 sets daily. Third, maintain consistency. Most men observe meaningful improvements within 4 to 6 weeks, including firmer erections, superior control, and even stronger orgasms. Consider this strength training for your most critical muscle group. The greatest advantage is you need absolutely no equipment. There are no valid excuses. Technique number two is vacuum therapy, commonly called the penile pump. Now, please don't dismiss this. This isn't some questionable product from late night television. Vacuum therapy represents a medically proven, doctor endorsed approach, particularly beneficial for men recovering from prostate surgeries or experiencing firmness challenges. Here's the mechanism. You position a cylinder over your penis. Gentle suction draws blood into the erectile tissue. A constriction ring can help maintain it there during intimacy. Biologically, this expands the tissue, enhances oxygenation, and conditions your blood vessels to respond more effectively over time. Emotionally, it provides reassurance. You possess a dependable option when needed. Practically speaking, it's straightforward. Most men use it for 10 to 15 minutes, 2 to 3 times weekly. An important warning: pumps are safe with proper use, but incorrect usage can cause bruising or pain. Therefore, consult a specialist before beginning and start gradually. Don't push too hard. When used appropriately, vacuum therapy not only works effectively, it can amplify medication effectiveness when used together. Think of this as physical rehabilitation for your circulatory system. You're not concealing the problem, you're actively strengthening your body's natural capabilities. Technique number 3 is penile traction therapy using an extender device. This is the method almost nobody discusses, yet it represents one of the most effective approaches for sustained intimate health. Penile traction devices, called extenders, serve purposes beyond cosmetic enhancement. They're utilized in urology practices by medical professionals to improve blood vessel health and tissue flexibility. Here's the biological process. Gentle, continuous traction encourages new blood vessel development. It increases flexibility in the erectile tissue. Gradually, this supports stronger, healthier erections. Research demonstrates that 1 to 2 hours daily, maintained consistently for 3 to 6 months, can dramatically improve firmness quality. Some men even experience moderate length increases. Emotionally, this restores feelings of vitality and optimism. You're not simply accepting decline, you're actively rebuilding. Practically, it demands dedication. It's not an instant solution, but commitment produces lasting results. One critical caution: correct fit and gradual tension are essential. Don't purchase an inexpensive device and apply excessive force. Approach this like physical rehabilitation, not entertainment. If you're genuinely committed to long-term blood vessel and tissue health, this method can create substantial improvements. Let me summarize your action plan. First, begin with pelvic floor strengthening. 10 repetitions 2 to 3 times daily. No equipment required, no excuses accepted. Second, incorporate vacuum therapy. 2 to 3 brief sessions weekly to maintain strong blood circulation and tissue health. Third, commit to traction therapy if you're serious about long-term vascular and tissue wellness. Combined together, these 3 techniques address the challenge from every direction: muscle strength, blood circulation, and tissue health. Remember, this isn't about quick shortcuts. It's about establishing a foundation for years of dependable, confident performance. I understand some of you may feel discouraged right now. Perhaps you've tried medications, perhaps you've faced disappointments, perhaps you've even withdrawn from intimacy because of fear. Let me offer you reassurance. Experiencing firmness difficulties doesn't mean you're damaged, it means you're human. And your presence here watching this reveals something important: you haven't given up. Biologically, your body possesses remarkable adaptability. Blood vessels can strengthen, muscles can develop, tissue can transform. Emotionally, you deserve intimacy, connection, and confidence, regardless of your age. Practically, these techniques provide tools you can implement today. Gentlemen, your erections represent more than just intimacy. They reflect overall health, vitality, and life quality. The stronger your pelvic floor, the healthier your blood flow, the more resilient your tissue, the more confident, energetic, and connected you'll feel throughout every aspect of your life. So here's my challenge for you. Choose one technique and begin today. Even if it's simply 10 pelvic floor exercises before sleep, small actions accumulate. If you found this helpful, please click that like button, subscribe to the channel, and share this video with someone who needs encouragement. Tell me in the comments which technique you'll try first. This is Dr. Ada James reminding you that age doesn't end vitality. With proper practices, your greatest years of intimacy, confidence, and fulfillment can still lie ahead. Stay strong, stay optimistic, and I'll see you next time.